imaging system here. It's just like looking through a telescope or through a microscope, but without a camera. Similarly, you have this long tube, and there is a lens which is present here. There is a lens which is present here. So you are looking at a distance, and the lens system gives you some degree of magnification, 10, 15 degrees. Okay. But the rest is all a flexible tube with a lens system, and so incidentally, if you look at this one here, this is what a side view scope is. You see that? All the lens systems and the other channels are opening here on the side. Tip is blind. This is a ERC scope or diurnal scope. The upper GA column, everything is present here. So this is a fiber optic diurnal scope basically. So how are you going to use it? Because this is the only thing, this is eyepiece which will show you. So you use it like this. And this is not a very enlarged image, isn't it? This is a very small lens system. And a little bit of magnification, and you introduce it and you work like this, seeing through this eyepiece at all times. That's the only thing. No image, and because there is no image which is formed anywhere except your retina, there is no image which is formed by this. So you cannot even capture image. There is no image to capture, isn't it? There is no camera system. You cannot take photographs, pictures. So in your report, there won't be any pictures, no photographs of the lesion, what you have done. And it is difficult to use this. So from time to time you're doing a procedure and now you want to take accessory inside. Every time you will have to take your eyes off this, ask for accessory, put it, and then again go back looking. So from time to time you will have to take your eyes off this. So these are the older ones. But nowadays what we have are the video endoscopes. So if you look at the two, the only difference between the two is that eyepiece. See that? That is a video scope and it doesn't have eyepiece. Just by looking at the scope, you can tell that that is fiber optic and this one is video. The rest, everything is same except for the eyepiece. So you don't need an eyepiece for this. This is a video endoscope. Okay. This is an electronic scope. Beside the lens system, there are electronics here. That was purely optical lens system. But this gives us a lot of additional features. So in this there is a chip. Okay. So how to use this? You use them like your laparoscopic camera systems. Exactly in the same way. So there also you had a chip which we saw. In a charge coupling device, there is a chip present. Same kind of chip is present here. So this is the lens system. This is the tip of the scope, and you have a lens here. Just behind the lens, a centimeter or two, there is a chip which is present. And as with your laparoscopic cameras, when the light which is reflected from the tissue falls on that chip, it generates an electromagnetic signal. And it's the signal which is transmitted along the length of the scope. And this is again connected to your image processor. Yeah? Same like your camera head, which has a CCD. You connect the camera head to your image processor, that box which we call the camera. And the camera is connected to the monitor. And you have an image on the monitor. Exactly in the same. So now the image is being transmitted in the form of signals. So once you have signals, you can always modulate, modify, alter the signals. Anywhere it is possible. Whether they are radio signals, whether they are radio signals or your light signals or any kind of sound signal, whatever, microwave signals, so you can modify them. So this is the limitation of your fiber optic scope. I have already told you. There is no monitor for image. There is no image processor. There is no image. You cannot capture the image. Video endoscopes, on the other hand, because they have a CCD inside, they give you an image. And once you have those signals, you can increase. You have all the features, including white balance. As you do a white balance for your routine cameras, you do a white balance for your endoscopes. So all the features are available. You can magnify the image. You can freeze the image. You can capture the image. So all these are possible because it is signals which are being transmitted, and we can modify and capture the signals. So this gives you advantage. First of all, you see the image on the screen. So this is difficult to work to do a procedure, isn't it? Having a large monitor in front of you is much easier. It will give you a large view, and if you have very high quality, you have a very high quality. The resolution goes up because the pixels are high. If you have a very high-end system which you are having nowadays, it gives you a very crystal clear detail. The resolution is very high. So all these things are possible. You can capture an image. You want to discuss this image with your, you can just freeze that image there. You can magnify the image. Plus all the things which we discussed earlier. NBI mode is there. You can connect a EOS to this. This can be, EOS scope would be very similar to this, except that it will have a ultrasound transducer. These are your video endoscopes. So what are the various parts of endoscopic system? So this is what a normal assembly would look like. So it has a monitor here, and then you will have either one box, or if you look at, there are two boxes. See this? And then this is the entire scope which is connected. So what are these boxes? You have basically two things here. One is this upper one is your, again, your image processor. The signals go here, and it's the job of this box to generate an image and project it onto the monitor here. This is your light source. Here all the additional features, whether it is light source and a air water pump, which is something additional which you use and require for endoscopy. Both are integrated into one unit. Okay? Because you need both always in all your procedures. You need air and water also. So this is that. But in some different series, so I'm going to show you the standard, but you must know different series, different brands. So features remain the same. For example, this one is a one common box rather than having two separate boxes. This is more handy. Some people have a mobile sort of a practice. Rather than carrying all these things, you just need to carry this and this. Monitor is usually used. So those kind of options are available, and they're all video. So how does a scope come to you? From the very beginning, if you receive a scope, they usually come in this customized box. They are very delicate instruments. They may look sturdy, but they are very delicate. So they come in their own customized box like this, and then you take it out for using it. So the first thing which you should learn is, the first thing which you should learn about your scope is how to hold this scope. So this is one end,